Alright, so first I'm gonna show my surroundings. Try to get the entire stupid table. There we go. Going on this side, nothing. Back over yonder, nothing. Nothing. Make eye contact with Teresa, okay? So, my paper is blank. Okay. First, I will take 1 to 2 minutes to do my brain dump. Hi, my name is Danielle. I'm going to be your student nurse today. First thing I'm going to do is I'm going to perform hand hygiene. Turn your eyes fully. Get every nook and cranny. Okay, so, my name is Danielle. I'm going to be your student nurse today. Can I get your first and last name? Tammy Eichells. And your date of birth? 5/22/76. I'm going to just check your band. Looks good. So it looks like today we have provider's orders to do a cardiovascular assessment. Is that okay? Mm-hmm. All right. Do you have any allergies? No. Do you have any chest pain? No. Have you ever had a stroke or heart attack? No. Do you ever feel dizzy or pass out? No. No. Okay. So first thing I'm going to do is have you lay down on the bed. Okay, I'm going to cleanse my equipment with I ripped the alcohol wipe in half, but I'm still going to cleanse my equipment properly. As so. Okay. So first I'm going to raise the head of the bed a little bit. I'm looking for jugular vein distension. So I'm going to have you turn your head towards the curtain there to properly examine for jugular vein distension. Okay, and there is none present. Now I'm going to inspect your chest. I am looking for discoloration, abnormalities, any lesions or scars. So you're just going to feel me inspecting your chest. I'm going to palpate the pericardium, looking for any heaves or thrills, and there's none, and there's no tenderness seen there. I'm going to inspect the lips and the arms and legs for any discoloration, and there is none, which is good. There's no signs of pallor or cyanosis. Do you know today's date? February 2nd, 2023. All right. Patient is alert and conscious, alert and oriented, fully conscious. Okay, I'm going to check for edema. I'm palpating, and there's no edema present on either leg. If there were edema present, the edema scale is +1, has 2 millimeters distension, depression with a rapid return, +2 is 4 millimeters depression with 10 to 15 seconds of return, +3 is 6 millimeters depression with 1 to 2 minutes of return, and +4 is gross edema, 8 millimeters of depression with 2 to 3 minutes of return. I am going to palpate the fingernails, looking for capillary refill, and that is immediate, which is good. I would check the toes as well. I am going to feel for her carotid arteries, doing one at a time so I do not cut off blood flow to her brain. I am now going to inspect the peripheral arteries, okay, starting with temporal. I am looking for equal rate, rhythm, and amplitude. Now I have brachial. And then I have radial, ulnar, femoral, and I have you bend your knees a little bit, popliteal, back down, thank you, tibial femoris, and dorsal pediis. All of that looks good. I am now going to use the bell side of my stethoscope to listen to your carotid arteries and your your valves of your heart. Using the bell side of my diaphragm, I am going to listen to her carotid arteries, and both of them sound good. Still using the bell side of my stethoscope, I am going to listen to her aortic valve, which is 2 intercostals below the clavicle, and her pulmonic, which is 2 intercostals below the clavicle on the patient's left side. Now I'm going to listen to Erb's point, which is the third intercostal space on the midclavicular line. And I'm now going to lift your shirts up. Thank you. I'm going to listen to her tricuspid, which is fourth, and her mitral, which is fifth. All right, I'm now going to do the same thing, but with the diaphragm side of my stethoscope, starting at her aortic, pulmonic, and these two is where you can hear S1 the most present, or it's where it's the loudest, and then Erb's point, which is where S1 and S2 are equal, and then I'm going to go down to tricuspid and mitral. Here, for the tricuspid and the mitral is where S1 is most present. I am now going to take her apical pulse. I got 81 beats per minute for your apical pulse. There was no signs of edema. I felt all of your pulses looked for equal rate and rhythm on each side. There were no heaves and thrills on your pericardium when I palpated. No signs of pallor or stenosis. No JDV present. All right, I'm now going to clean my equipment. And I will document my findings. I'm going to perform hand hygiene, making sure that the bed is lowered and locked and there are no signs of a fall risk. I'm going to make sure she has her call light within reach. Her bedside table is within reach. Is there anything else I can do for you today while I have time? No? All right, thank you.